So let's talk about the hand hygiene. It's very crucial to wash your hands before and after getting in contact with the patient. Before performing any aseptic procedure or after getting in contact with the body fluids, for 20 seconds, use water and soap to wash your hands. Remove your rings and watches before performing any procedure and try to keep your nails neat and clean and also small to avoid any contamination or production of pathogens. Let's talk about the hand washing procedure. Firstly, wet your hands with the tap running water. Secondly, use the adequate amount of soap to rub your both the hands and create the lather. Then try to rub back of your hands, fingers, thumb, and fingertips. Also wrist systematically. Then rub your fingertips and nails against palms and use 20 seconds to properly rub your hands and then rinse with the tap running water. Use the dry disposable towel to dry off your hands and use the same towel to turn the tap off to avoid any recontamination. Now let's talk about the aseptic techniques. This procedure is to avoid any kind of microbial contamination. It's very important to have the proper hand hygiene and use the sterile gloves to perform any aseptic technique. Use the sterile instruments and try to perform the procedure in the sterile environment. Whenever touching the sterile bags, try to not touch inside it to avoid any contamination. Try to keep all the instruments above waist level or within VN. Don't sneeze or cough over the sterile instruments and use the aseptic solution like iodine, alcohol, or chlorhexidine to clean the patient's skin or wound. Let them dry and use the non-touch techniques. Mm, Try to keep the procedure minimum to avoid any contamination risk and dispose all the instruments into the puncture proof baskets. Use the sterile dressings to cover the wounds after cleaning the wound of the patient, and then properly take the gloves off and perform the hand hygiene. All of these aseptic procedures help to avoid surgically site infections and sepsis. Now we are going to talk about the infection control techniques. This procedure is to avoid any transmission of infectious agents in the healthcare settings. For that, perform the proper hand hygiene before and after in coming in contact with the patient. Use the personal protective equipment, also the gloves before coming in contact with the blood, fluids, or contaminated content. Use the mask, gowns, and eye protection equipment before performing any aerosol generating procedures. Have the proper respiratory hygiene and cough etiquettes. Always disinfect the reusable medical equipment and use the aseptic techniques while performing any procedure on the patients. Always use the sterile needles and syringes for the safe infectious practicals, and segregate the biomedical waste according to the infection control protocols, and then isolate the patients with the contagious diseases. Also very crucial to vaccinate the healthcare workers for influenza, hepatitis B, as well as tuberculosis.